CEN Test Prep Exam HCC. Question 1. Which ECG finding is most indicative of hyperkalemia? Option A, prolonged QT interval. Option B, peak T waves. Option C, ST depression. Option D, delta waves. The correct answer is option B, peak T waves. Question 2. Fat embolism syndrome is most commonly associated with fractures of the option A, distal radius. Option B, pelvis and long bones. Option C, clavicle. Option D, metatarsals. The correct answer is option B, pelvis and long bones. Question 3. The hallmark sign of compartment syndrome is option A, pain relieved by elevation. Option B, pain out of proportion to the injury. Option C, absent pulse in the affected extremity. Option D, pitting edema. The correct answer is option B, pain out of proportion to the injury. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Le Fort fractures are classifications of fractures of the option A, mandible. Option B, mid-face and maxilla. Option C, orbit. Option D, nasal bones. The correct answer is option B, mid-face and maxilla. Question 5. What is the classic sign of a basilar skull fracture? Option A, Battle's sign, mastoid ecchymosis. Option B, rhinorrhea with glucose minus negative fluid. Option C, hemotympanum. Option D, all of the above. The correct answer is option D, all of the above. Question 6. The emergency nurse suspects acute epiglottitis in a patient presenting with option A, inspiratory stridor, drooling, and tripod positioning. Option B, barking cough, low-grade fever, and hoarseness. Option C, productive cough, pleuritic chest pain, and fever. Option D, a wheezing, prolonged expiration, and accessory muscle use. The correct answer is option A, inspiratory stridor, drooling, and tripod positioning. Question 7. A patient is brought in with decreased consciousness after being found outside in cold weather. Core temperature is 30 degrees Celsius 86 degrees Fahrenheit. What ECG change is the patient most at risk for? Option A, atrial flutter. Option B, prolonged QT interval. Option C, Osborne, J, wave. Option D, ST depression. The correct answer is option C, Osborne, J, wave. Question 8. A patient presents with severe epigastric pain radiating to the back, nausea, and vomiting. The nurse notes ecchymosis around the umbilicus. This finding is known as option A, Gray-Turner's sign. Option B, Cullen's sign. Option C, Murphy's sign. Option D, Rovsing's sign. The correct answer is option B, Cullen's sign. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A positive Koenig's sign is suggestive of option A, a cerebral aneurysm. Option B, subdural hematoma. Option C, meningeal irritation. Option D, cerebellar stroke. The correct answer is option C, meningeal irritation. Question 10. A patient who has received massive blood transfusion protocol is at risk for which electrolyte abnormality due to citrate preservative in blood products? Option A, hyperkalemia. Option B, hypercalcemia. Option C, hypocalcemia. Option D, hypermagnesemia. The correct answer is option C, hypocalcemia. Question 11. Sudden, painless loss of vision described as a curtain coming down over the eye is a classic presentation of option A, acute glaucoma. Option B, retinal detachment. Option C, corneal abrasion. Option D, cataract. The correct answer is option B, retinal detachment. Question 12. The emergency nurse is caring for a patient with suspected pericardial tamponade. Which triad of findings, Beck's triad, is most consistent with this diagnosis? Option A, fever, chest pain, friction rub. Option B, hypotension, muffled heart sounds, distended neck veins. Option C, hypertension, bounding pulses, headache. Option D, dyspnea, crackles, pink frothy sputum. The correct answer is option B, hypotension, muffled heart sounds, distended neck veins. Question 13. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to: Option A, administer oxygen. Option B, place the patient in Trendelenburg position. Option C, immediately discontinue the procedure. Option D, assess vital signs. The correct answer is option C, immediately discontinue the procedure. Question 14. The best method to remove a prosthetic eye in an emergency is: Option A, using forceps to grasp the prosthetic. Option B, applying suction with a bulb syringe. Option C, using a suction cup designed for prosthesis removal. Option D, sweeping a finger around the edge to break the suction. The correct answer is option C, using a suction cup designed for prosthesis removal. Question 15. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide minus complex tachycardia at 220 bpm. What is the priority intervention? Option A, administer amiodarone 300 mg for push. Option B, a synchronized cardioversion at 100 J. Option C, immediate high minus quality CPR and defibrillation. Option D, a transcutaneous pacing. The correct answer is option C, immediate high minus quality CPR and defibrillation. Question 16. Which of the following is a sentinel event that requires reporting to the Joint Commission? Option A, a patient fall that results in a minor abrasion. Option B, a medication error that causes no harm. Option C, a surgery on the wrong body part. Option D, an AMA discharge. The correct answer is option C, surgery on the wrong body part. Question 17. A patient presents with a chemical eye splash. What is the priority nursing intervention? Option A, patch both eyes. Option B, immediate copious irrigation with water or normal saline. Option C, administer topical antibiotic drops. Option D, perform a visual acuity test. The correct answer is option B, immediate copious irrigation with water or normal saline. Question 18. In a multiple minus casualty incident, the triage tag for a patient with breathing 30/min, no radial pulse, and who does not follow commands is: Option A, green, minor. Option B, yellow, delayed. Option C, red, immediate. Option D, black, deceased/expectant. The correct answer is option C, red, immediate. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is: Option A, forcing oral fluids. Option B, straining all urine. Option C, pain management. Option D, surgical consultation. The correct answer is option C, pain management. Question 20. After a blow to the nose, a patient develops clear, watery drainage that tests positive for glucose. This indicates: Option A, allergic rhinitis. Option B, nasal mucosal secretions. Option C, CSF leak, rhinorrhea. Option D, sinus infection. The correct answer is option C, CSF leak, rhinorrhea. Question 21. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because: Option A, cold water causes coronary artery dilation. Option B, hypothermia decreases metabolic demand and provides neuroprotection. Option C, cold water flushes the lungs of bacteria. Option D, the mammalian diving reflex eliminates the need for CPR. The correct answer is option B, Hypothermia decreases metabolic demand and provides neuroprotection. Question 22. Sengstaken minus Blakemore tube placement is used as a temporizing measure for bleeding from option A, peptic ulcer, option B, esophageal varices, option C, diverticulosis, option D, aortoenteric fistula. The correct answer is option B, esophageal varices. Question 23. The most common cause of lower gastrointestinal bleeding in adults is option A, gastric ulcer, option B, diverticulosis, option C, esophageal varices, option D, Mallory-Weiss-Tear. The correct answer is option B, diverticulosis. Question 24. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates option A, a damage above the midbrain, option B, a damage at or below the midbrain/brainstem, option C, damage to the cerebral cortex, option D, a positive outcome. The correct answer is option B, damage at or below the midbrain/brainstem. Question 25. A nurse witnesses a colleague diverting narcotics. What is the appropriate initial action? Option A, confront the colleague directly. Option B, report the observation to the charge nurse or manager immediately. Option C, document the observation in the patient's chart. Option D, call the police. The correct answer is option B, report the observation to the charge nurse or manager immediately.